Hi, I'm Dr. Josie Millar, University of Bath. This year, the focus of Mental Health Awareness Week is on loneliness. This is important because loneliness is something that can affect us all, but it's not often that we talk about this. In my work as a clinical psychologist and researcher, I'm passionate about helping people with obsessive compulsive disorder. OCD is where people experience unwanted, persistent thoughts or images about some kind of harm coming to themselves or others. In response to this, they carry out compulsions aimed at preventing that harm from occurring. I'm really interested in finding out how we can help people to keep well after they've had a talking therapy for OCD called cognitive behaviour therapy. Because at the moment, up to 60% of people will experience a relapse after CBT. We know that people with OCD are impacted by loneliness, but up until now, we didn't have a good understanding of how this might impact their recovery and potentially relapse. This is important to understand so that we can consider how and when interventions aimed at rebuilding social connection might be most helpful. I've been leading this research funded by UKRI through the Loneliness and Social Isolation in Mental Health Research Network with my colleagues Dr. Erin Waits, Professor Julie Barnett and several experts by experience. Together we interviewed 23 people with OCD. We found that many people with OCD had suffered with loneliness for many years before seeking help due to fear of stigma. As people's OCD symptoms became worse, their lives became more insular and experiences of loneliness increased and social connections were often lost. CBT was reported as being helpful for treating OCD symptoms, but it had often not addressed the lack of social connection people were experiencing or how this was linked to low mood or how people could begin to tackle this. As people's recovery increased, the importance of social connection became more apparent. However, people reported barriers to reconnecting socially, including fears of judgment and feelings of shame about their OCD. Linking in with others who have a shared understanding of OCD through experience was identified as a valuable first step in reconnecting socially. An intervention delivered as either a part of a standard treatment or after therapy was deemed essential by participants. In response to this, we're now in the process of developing this intervention.